Thank you, and thanks everybody for joining today. It's lovely to see so many online interested to hear about our social prescribing project. In terms of questions for the chat, I thought it might be good to just focus on a couple of areas. So my suggestions were to just think about if there was anything that you wanted to ask about the evaluation, anything that you wanted to ask about operations and in practice how it worked, or any general thoughts on children and young people social prescribing in Leeds. And like Kim says, if you pop it in the chat, then if we don't get to it today or we aren't able to answer it today, we'll definitely find an answer and come back to you all. So just being a little bit backwards to go forwards, because Sinead's online and has very kindly offered to speak but can't stay on for the whole meeting. So as a result of and as part of the journey of the social prescribing project, Armley PCN commissioned us to work directly with their young people. Because the pilot was so small, they were concerned that they would oversubscribe the pilot with referrals for their young people. So to ensure that their young people had kind of access to support, they funded us to work directly with them. So Sinead just wanted to talk about and share her experience of that as well to begin with. So Sinead, shall I just let you jump on really quickly? Is that okay?
Laura, I can stay on for about 15 minutes. So unless I don't know if it's going to be contextually better for you to just give an introduction and then I'll sort of just say about our experience. Yeah, don't worry.
Okay, great. Thanks, Sinead. That's great. Okay. So if I move then into the presentation, if we go to this, to go through to the next slide and then the one after that, Kim. That one, great. So I just wanted to set the context first in terms of who Barker are. So I think many of you will have heard of Barker, but I wasn't sure if you knew kind of the range of services that we offer. So we have 3 streams of work at Barker. There's children, young people and families, which is the stream I look after and where social prescribing sat. So that's the focus there is children and young people. We have family support services, we have youth work services, we have counselling and wellbeing services, and we have our family drug and alcohol court service as well. We have complex health and housing, who pick up frequent users of A&E, for example, as well as a range of housing services, and then Forward Leeds, drug and alcohol services. And then we have our employability and community health teams, again focused on Bramley and the West mainly as our community anchor hub, providing public health support and general well-being to the adult population, and then employability support across age ranges. And so I set that out just because I feel like it was part of our model, was the services that we had access to and the ability to seamlessly support young people into options and offers, and part of that was what Barker already had established. But obviously what we recognise as Barker is that we can't work on our own. So if we just go to the next slide, Kim, what I wanted to just also touch on was the range of working together partnerships we already have, very much across both community, statutory and health networks. So as you'll see there, a few branded services: Leeds Youth Alliance, Engage Leeds, Linking Leeds, Men's Health, Better Together. So we're all tied into those networks and part of those networks, delivering within those services, so that working together was really important in connecting and being able to support young people and do the connecting part of social prescribing. As part of our decision making when we set up the Connect Together service, we also partnered with Health for All. So we seconded a worker from Health for All to join our social prescribing service, because whilst we had that knowledge in the West where we were going to operate, they had that knowledge in the South and those connections in the South to support and make sure we were most effective. So if we can just jump to the next slide. Thank you. So in terms of our ethos and our way of working, it was very much about engaging communities, unlocking barriers, and working to improve life skills, life chances for positive futures, and to make sure that things are sustainable. So they were kind of, I guess, the values that Barker brought and Health for All brought to the Connect Together service. So I just wanted to set that context first. So if we go to the next slide, and then we can focus on the Connect Together service. So Connect Together was a pilot project to provide one-to-one support, group work support and engagement between services and community members to improve health and well-being. So it's delivered in a community setting by our partnership of Barker Leeds and Health for All, and our evaluation that I'm talking through ran from September 22 to September 23, and that was carried out by Leeds Beckett University, who summed up that the evaluation demonstrated that Connect Together had a positive impact on the lives of children, young people and families they work with, and that it actually had a positive impact on the entire family. So I'll go into our model and why that impact on the family was really important to our particular model of working. I know that there are various models of working with social prescribing, both for adults and for children and young people, and across the UK as well. There's various models. So I think it's not necessarily that our way of doing it is the only way of doing it, but I think we were quite proud of our way and felt that it worked for us and it worked for the young people and families that came into our service. So in terms of our model, the practicality of our model was having that local knowledge, having that local connection of services so that it could be a seamless connection, feedback was important. So we made sure we had processes that kept people informed, and that closing summaries were completed so that the family knew what their exit plan was, what was sustainable, but also that the referring agency or services that were providing ongoing support, such as GPs and schools, understood what support had been provided. And also avoided duplications. So, for example, a young person with neurodiversity who was on the waiting list for support and having intrusive thoughts, they were supported with a range of referrals that were then shared with the GP, so that when they went back to the GP, they weren't having to make referrals that had already been made. They knew kind of what was already in place and what support had already been provided. So what the evaluation found was that unique package of personalised social support with the extended family was what worked, and the delivering of a group work offer that places children or young people at the centre of their lived experience was really important as well. So we were able to offer a range of group activities, from hot trips in the holidays to peer wellbeing support groups to a yoga group, and that really helped as stepping stones for some young people who maybe had a lot of anxieties or had been quite isolated from their communities and needed that safe support network into groups before they joined wider groups. And so the ultimate goal really was about building that young person's confidence to access their wider community, and to provide a safety net so that young person felt self-assured to participate in those activities. So the level of support varied depending on what the young person needed, and it was a very hands-on support of kind of meeting with young people, taking them to venues, and kind of working on that whole picture of what's going on for them, and where those support and barriers were. So it highlighted for us the difference between an adult social prescribing and children's social prescribing service was really that relational approach of it being about who the young person was and what support they needed, and having the time to engage a bit more long term and a bit more full on in a flexible way. So it wasn't about signposting to services, but rather engaging children and young people in being in a more involved approach. And I think that's recognising the difference of young people in terms of their lived experience and maybe their agency and independence to do things on their own, If I was an adult in an adult social prescribing service, for example, you could tell me that yoga at Holt Park would be really beneficial, and I might be like, yeah, that's really interesting, I want to go. And I've got the lived experience to think through, how might I get there, what bus might I need to catch. I might be anxious, but I can regulate that and work my way there, whereas a child or young person might not be as able to make those choices for themselves independently, or to know how to find the right bus to get there, and might need support with that. So it was a lot more hands-on in terms of that support. So if we could just go to the next slide, and sorry, the one after that. And so yeah, so that kind of that flexibility was really important, and that time to do that. And I think really that setting then within a non-clinical model really helped build with the trust for young people to engage and to support with issues that I guess are social in their presentation. So whilst it might be impacting on their mental health or impacting on their physical health, that those needs come out of a social situation, that we're able to support and develop relationships with young people to be that connector and that link between education, between health, and sit in the middle of all that and see where those bridges need to be either mended or built to support the young person and to address those social determinants of their health and well-being. So if we just go to the next slide. Thank you. So that's why we chose an integrated whole family approach, because it allowed us to develop those relationships to address some of the issues that were impacting on self-harm, impacting on their physical health, reduce the isolation, and support a smooth transition into adult services if needed by the young person or by the wider family. So and as I'll go into some examples, some of our work also required us to refer adults into support as well as young people into support.
Still need it, Justine, but sorry.
So I was just going to say, I was just going to hand over to you now, Sinead, and just say if you can talk about that link between, so that's what was our link with young people, our link with schools, which I'll come on to later. But if you could just talk about that link with GPs and surgeries, that'd be great, Sinead.
Sorry, I thought I was on mute.
That's all right.
Yeah, so obviously I'm the PCN, we're quite local to Barker, and Barker it's a charity that I know, you know, that they provide a wealth of amazing wellbeing activities to, you know, both adults and young people. So when we did want to have a dedicated young person social prescriber, it was, you know, it was an absolute that we were going to go and approach Barker. And I guess from our perspective, as with a lot of PCNs, you've probably got a lot of parents and young people presenting and representing because of waiting lists, you know, MindMate, the fact that people, you know, parents really don't understand the difference between the different referral routes into CAMS, and they, you know, they don't realise that MindMate are sort of a gatekeeper for that wider service. And sometimes, you know, even the GPs are, you know, confused about how the service works. So having a young person social prescriber that can really help bring it all together, explain to families, look, you know, obviously this is a triage has taken place, but MindMate, they've identified that this is the correct pathway for you. It's still not felt like enough for a lot of families, so we knew we needed to get something in to support these families, and that's exactly what Jenny has done, which is our dedicated young person social prescriber. She's been fantastic. It basically takes the pressure off, so when people are, you know, when families and young people are coming to the GPs, we've just got a direct referral route. We do a simple, you know, referral form. We send it across via email, and then Jenny and Barker take care of everything. And we have a shared drive, so Jenny can put updates in there. She will also email me if we've got anything that we, you know, that I feel are clinically relevant for the patient's notes, and that's a big way to avoid any duplication. So an example is sometimes when the GPs are, you know, explaining things to parents and they're not fully understanding, they'll keep representing with the same issues because they don't understand that their child sat on maybe a 2+ year wait for a neurodevelopment assessment with you know, CAMS. So it just gives us an alternative to offer, like health and support. And I think the other thing is we were finding that sometimes it was difficult with parents, because the issues they would present with their young person were not issues that were going to be resolved by having had a diagnosis. Those issues would still be present regardless of when they've got that diagnosis. And I think they maybe sometimes overthink the after support that might be available after after a diagnosis. So ultimately, it's good to just look at the wider health and social needs of that young person, and try and get them into a really a positive place, trying to get them engaged in community activities, understanding their own health and well-being a little bit more, and just having just being able to offload and things like that. And that's not going to necessarily come at the end of a 2-year assessment with CAMS. So I think it aligns, it's a little bit more realistic as well. And Jenny's just been, yeah, she's been fantastic. Sorry, I didn't say I'm from Armley PCN, so we're a really small PCN, just 3 GP practices. But even as a small PCN, we're still inundated with referrals, with patients presenting with their young people, children, ringing on their behalf, just not sure where to go. And having the direct referral into a dedicated young person social prescriber means that we can say, look, this is this is what we can obviously offer. We'll explain to parents that it's not a clinician, and it's not a clinical review, but it's going to look at the wider social health of the young person. And actually what we found as well with a lot of our young people, so we've had quite a few examples where they've been bouncing around the GP practice. So they've been bouncing around. We've been signposting to MindMate. MindMate will do a triage call. The young person doesn't engage. And we've had one particular young lady that was very vulnerable in our GP practice, and she just wasn't able to engage with those sort of clinicians in that environment. However, when we've referred her to Jenny, she really has. She's engaged, and Jenny's done a really good piece of work. And there was a lot of risk that came out of it, but Jenny was able to liaise with early help hubs, children's social care when needed, and the cluster. So Jenny will attend the local clusters, advice and guidance sessions, and present the case. So she just is the voice, I guess, for that young person, and really advocating for them and the further support that they may need. And that's just something that our clinicians just don't have time to do, unfortunately. As much as they'd love to, they just don't. All they can really do is give the MindMate information. But this is just, it's just another layer that we can offer. And when we take the referrals, we will often ring mum or dad to get the referral information, and they're so grateful. They'll say like how such a relief. And some of those people have been through CAMS already or been through MindMate, and they'll say it just didn't tick all the boxes. Whereas they're seeing the young person then engaging in some of the amazing groups that Barker have on offer. They're getting out more than they were. The school attendance is improving. Jenny will liaise with schools as well, which is another big request at our PCM. We would have people come in and saying, school need a letter for this, and it was just, and I used to think, I'm not sure that's quite right. However, maybe it is, but Jenny was able to go into school and host some appointments with young people, get to know the Senkos or the pastoral support within schools. So she's then built that network. And yeah, can just advocate, and then I can type up on the notes anything that's clinically relevant and put updates on, so that when parents maybe are representing or young people are representing, at least the GPs have them notes there, and they can say, oh well, I know the school, you've done this piece of work or that piece of work. And sometimes it's that gentle challenge as well, just for to ensure that parents are not over expecting things, and just that reassurance that look, everything is in place. But I think until the GPs have got that reassurance on the notes that those things are in place, they will just keep making the referral back to MindMate, because they're just going to take the parents' word, like, oh, nothing's been done, or school aren't doing this. But then when we can update the notes and say, no, school are offering these 6 interventions, and then they've got and then MindMate have offered their short-term like intervention, or family therapy, or the cluster have offered something, it just brings it all together onto the patient's record, and it can really help. It's taken a lot of pressure off off GPs who were just, they really weren't sure what to do with those reoccurring families that were just bouncing around all the time. So yeah, I can only, it's been really, really positive. And if anyone wanted to get in contact with me, again, I'll leave my email in the chat. So if anyone wanted to know more on a PCN level, how it works, logistically, how we make referrals, how we keep it, how we work closer with Barker, then you can absolutely email me from that side. And I would say as well, as a PCN, we've subcontracted quite a lot of roles. So we've got, we've got physios, and we've got other subcontracted roles with other providers. But truly, honestly, Barker have been one of the best people to contract with. With just really smooth transition. They take all of the responsibilities away from the line management, that side of things, supervision, and also they have such a good network, like Laura mentioned in the beginning. They've got so many different services that they're not having to reinvent anything. Them social prescribers are fully supported, and they've got their own LGBTQ plus group, or they've got their own gaming group. They've got all those things there ready for the young person to be fed straight into. So I think that really benefits the young person as well, and they really get to know the community and Barker as a whole. And yeah, the reports, we'll get reports, so we'll always be kept up to date with how things are going. And we can sometimes look at, is there some practices that aren't utilising quite enough, and then we can promote it a little bit more. So just an example of that, when it first took off and we just wanted to get the referrals coming, we did a search on the clinical systems for any young person that had been signposted to MindMate in the last 12 months, and then I sent an AccuRx template out just explaining the fact that we've got a dedicated young person social prescriber. It had a link with a little bit about what that meant, and I just said respond with a yes if you're interested in being referred. And from that, I got way more referrals than way more responses, sorry, than I realized that I would get, really. And I was like, oh, okay. So then I started to contact those parents, and yeah, just explore with them, make sure they understood exactly what it would be, and that it wasn't a replacement for therapy, or it wasn't a replacement for a MindMate referral, but that it was just to enhance what maybe is already in place. So yeah, there's lots of ways. If you was worried about utilization, or how you would get those referrals sort of up and running in the first place, there's lots of different ways you could do it as well. So yeah, I'll leave my email, but happy to answer any questions as well, like, or get in touch with me. That's absolutely fine.
Thanks, Sinead. Thanks so much for being so kind about Barker, and thanks for giving such a good explanation of the day-to-day running and partnership of the social prescribing in action. Hopefully that was a real visual account for people on how it's worked. So yeah, so just building on that, if we just go to the next slide. So for us, one of the things was around that kind of working closely and thinking about what social prescribing is and was. So for us, it was about understanding where social prescribing sat within the intervention sphere, and that actually what was really important, that we were connecting, that we weren't the intervention ourselves, but we were the connecting that intervention. So we only worked with young people short term. It was 6 to 8 weeks, and a lot of that was building trust and relationships, getting to understand the young person and understand where their wants and needs were, so that we could make that connection or advocate. So for example, if it was that they were in the right place, so in school, for example, it was doing that advocacy and that connecting, so that the school had a better understanding of what was going on in the young person's life. The young person understood how the school was trying to support them, and that relationship was improved as well. So it was really about kind of acting as the first and last link in a chain of connecting social support. And so we really set out our processes from the start, but then our service wasn't driven by those processes, but those processes became the scaffolding in which we could have a relational approach with young person and with the family, and help them kind of connect and make the changes they want to make. So if we just go to the next slide, it'll help us talk a little bit more about actually the service. So as I said, the service mobilised in September 2022. We chose to operate within the west and south of Leeds, partly because they were where we could mobilise quickly, but also that they did feature in the health inequalities, and had less maybe services going into them than some other areas of the city at that point in time in terms of the health inequalities funding. So we focused on the Beeston and Middleton and Wortley PCN and the Bramley PCN. Sorry, I got that the wrong way around. It was the Bramley, Wortley and Middleton PCN and the Beeston PCN. So it basically covered the LS10 to the LS13 postcodes. But again, it was still only a small service. That was 3 full-time workers working across all of those postcodes. So over the course of the year of the evaluation, we supported 111 children and young people through one-to-ones, and then a further 20, I think it was about 20-25, only engaged in the group work activities. So they didn't need the one-to-one support, they just went straight into the groups and participated in the group work programme, and then that was the support that they wanted. Our sources of referrals were really varied. Education was the biggest referrer. So again, that was about our links with schools and with clusters to support those referrals. But we did have referrals across the health and social care sector, and quite a lot of self-referrals as well, quite often from parents. It's sometimes hard to know where those self-referrals come from, because whilst we ask people to fill in the information on the referral form, they don't always. But I know some mentioned that they'd Googled support and that Barker had come up, so they'd found us that way. Or some had come from posts that they'd seen in their GP practices, or from kind of hearing from people that the service was there and something they could access. Our age range was 4/5, so basically the primary school age up to 16. For 16 to 18-year-olds, we would work with them if we were the appropriate service. So we would work with the young person and work with Lincoln Leeds and kind of just look at that young person and kind of where their best support would be, because some young people would thrive more in an adult-based service, whereas some young people in that age range would benefit more from our children and young persons more intensive approach. So as you can see from the our bar chart there, predominantly our age range was 11 to 15. So I would say that the 13 to 15-year-olds was the most prominent age range we worked with, but we did work with some in the 16 to 18 age range and some 5 to 10-year-olds as well, where we predominantly worked more with the parent. From our impact, what we found was that there was a 88% reported improvement in their emotional health and well-being. 71% felt their family of support had increased. 95% felt listened to by their worker, that their sessions were easy to access and clear and understandable. 93% felt supported. 88% would recommend us to our friends. So we had some really good feedback on from the young people in terms of the difference it made, from parents in terms of the difference it made, and like I said, feeding into the evaluation, it showed that there was a change in mental and physical well-being for the children and young people. If we could just go to the next slide. So as you won't be surprised, a lot of our referrals were around emotional health and well-being, and isolation and loss. School attendance was second on the list after well-being, but quite often they were interlinked. And so quite often you'd see both impacting on each other, and a lot of neurodiversity. Whilst it wasn't featured as a reason for referral, quite often what we found, as Sinead touched on, young people and parents were either waiting for a diagnosis, suspected that there might be a diagnosis required, or has a diagnosis, but then didn't have the support mechanisms around them to support the ongoing presenting needs that young person was having to deal to manage and deal with. So if we just go to the next slide. The other bit that our evaluation on our data was able to show was that journey of change. So the diagram on the left is at the first point of engagement. So we used a mechanism called MyStar, which is part of the Outcome Star suite, which is an evaluated framework model for collecting outcomes. So it looked across 7 domains of their life in terms of if they felt safe, how they felt about relationship with their peers, with their parents, how they felt about their confidence and well-being. And it asked young people to rate at that at the start of their journey, and then they reflected on it at the end of their journey and ongoing in between their journey if that was needed as well. And there was a shift in both how many challenges young people had across the different domains, but also within the domains. So the green colours on the bar chart are where they feel more confident and happy, and the red and orange colours are where they're feeling concerns and had worries. And as you can see in between the both bar charts, that the greens and the red, the greens increased by the end of their service, meaning that they had been a positive shift, and the risk was reduced, and the young people's worries and concerns had reduced through their engagement in the service. So I think, so then if we just go to the next slide, so what the evaluation really highlighted was that it had improved lives for young people, and that they engaged in several different ways, that it was particularly useful as an early intervention or preventative approach, and that it was able to resolve some issues before they became statutory concerns or escalated into crisis, and that whole system approach helped make the link between children and young people's diet, activity and sleep patterns. So quite often what would be on the referral might be kind of about anxiety, low mood, or a particular incident that happened. But in speaking to the young person, using the outcome star to look at what was going on across the whole approach, often what you might find is that the family didn't have money and were struggling financially, so the diet wasn't kind of as healthy and nutritious as it could be, or that the young people were had disrupted sleep patterns, and that it was really helpful to do information and educational work with both the young person and the parents around healthy sleep patterns, or looking at kind of support around diet or around kind of some of the financial struggles. So we might have done referrals, for example, into Green Doctors being a fuel and debt support service, or supporting and linking into food banks. So what we looked at in our service was onward referrals. So one of the other things that it demonstrated was that our pilot was really good at that, connecting into wider community organisations. And if you look in the evaluation, I think there's an appendix at the end that has a list of the wide range of services that we supported young people into, which was a range of community football groups, like football, sport, LGBT, mental health support, might be other youth services and voluntary sector organisations, and their kind of social activity groups, Green Doctors, food banks. There was a whole raft of services that we referred young people into. And there was only 3 people where we didn't find a service to meet their needs. And again, that was that understanding what's available, understanding the raft of services and support that is available in Leeds, and being able to support young people into accessing them, but also kind of being able to kind of understand where there might be gaps, speaking to people and having a look at kind of either being flexible with capacity or kind of groups coming up, and doing a bit of pre-planning with providers as well, on kind of groups going forward. And I think it was that so children and young people felt supported within their schools and have been able to access appropriate support and advice as well. So really building up that kind of sustainable link of who's the young person's wider network that is going to be there longer term and be able to support them if things crop up in the future, and really seeing a difference in the confidence of young people, and how they can regulate their emotions, manage their anxiety and overcome feelings of low mood. So I just wanted to move then on. If we can move on to the next slide, I've just got a couple of case studies that again hopefully bring that to life. So one example focuses on a long-term health condition. So the young person had a muscular dystrophy. They were referred because of their kind of isolation and kind of wants to be connected into their community, but not knowing how to go around it. When they met with the Connect Together worker and talked at their goals, he talked about wanting to get out more, really liking football, but it also picked up that maybe that there was some work to do around managing and regulating emotions as well. So the worker did a short piece of work to offer some kind of education in initial educational points, and to look at choices and consequences, and use board games to help kind of him understand and learn about his emotions, be aware of what they are and how he can manage them. And then alongside that, they also introduced them to a power football club. So they went to do accessible sports, and we helped with that. So the family didn't necessarily have the means to support all of the football. So we used a personalised support fund to pay for the year-long membership, so that the family then only had to pay for the weekly membership for each class. So that was set up, and they were able to do that as well. Because of the kind of the wider family support needs, we also supported the young person and their mum to go for wellbeing sessions at the Donkery Sanctuary, and just help build that relationship and build up some positive factors around emotional resilience, and link them into the Breeze summer camp and the arcade club in Leeds. So again, they were just getting out a bit more and kind of building up their confidence in connecting into what was already available in their local community. So the young person there consented us to share the picture, and what was really lovely was that they created a card and sent it to the social prescriber and to say thank you, and to show them out and about at their football club. And so it was just really lovely that they took the time to create that card and to kind of show the impact that being able to have that support and increase their knowledge on how to connect into their community made a difference for them. If we just go to the next one. So then for the next one, we had a young person called Jay who was having difficulty in school due to being bullied, and they'd, as a result, stopped attending. So we went out to see them, have a chat around what could be better in school, arrange a meeting with school to help have support plan be put in place. And as part of that, what came out was that they were also exploring their gender and identity, and didn't have anywhere to go with that in terms of didn't know how to talk to people about it, didn't know where to go to kind of test out who they wanted to be and kind of safely explore that. So we introduced them to a worker from our LGBT group. So again, we were able to set up that meeting, use our trust with the trust the young person had built up with us to help them feel safe with the LGBT worker, to meet up with them and do that handover of support. From meeting the LGBT worker, then they felt confident to attend the LGBT group, and so they went into that group and then started making friends, and then increasing their social network. So they were meeting outside of the group, starting WhatsApping the young people from inside the group. So again, it just helped increase their sense of being accepted, of feeling like they could be who they wanted to be, of feeling that school understood what was going on for them as well. So their attendance increased, they had a friendship group, and so it just really made a difference for that young person. And then if we just move on to the next slide, and the final one, again, it just touches on kind of pulling together that wider support look. So a young person, again, isolated, not going to school, wanting to didn't want to socialise with anybody, and didn't particularly want to engage in support, but our social prescriber being able to be persistent in a friendly, persistent way, in terms of having that time to try again, to knock on again, to say, I'm here if you need support, this is what I can offer, gradually build up that trust that they weren't going to go away, that they were there for the young person, and they weren't coming with their own agenda, they were coming with whatever the young person wanted it to be. So eventually they took up that one-to-one support and started to open up about how they feel. So they built confidence and started attending the local youth group and skate park session at LS10, and then started feeling comfortable to go on their own, so they didn't need the worker to go anymore. But as part of that journey, what was also apparent was, when we were looking at the whole picture, was actually there were struggles in the house as well, and that finances were under pressure. So mum was supported to access a food pantry and Green Doctors to help with energy and food bills. And then at the end of that time with us, mum shared how happy she was about the positive changes in the young person's mood, and how the cost of the weekly shop had improved and felt much more manageable. And so just making those differences in the short term start building up that structure and that scaffolding into the future. Mum now knows that there are support services out there that she can access again. The young person's building up their connections into their community, their sense of belonging and being part of something. So I think those were the fundamental bits, I guess, that made this a successful pilot, and what the evaluation drew out was, I guess, articulated hopefully through those case studies. So if we just move on to the next slide. So the final slide is just around the model, and I guess picks up on where Kim started in terms of the Beeston PCN in the south. What we've looked at then is like some of the future potential of where social prescribing sits and can work. So in the Beeston PCN, they're looking at a children's health MD, a multidisciplinary team, and almost kind of having a hub mechanism that where information feeds back. So it's the social prescriber being that service that can link the GPs, the clusters, the schools, and the wider services together, so that a young person's just presenting in one place and getting the right support at the right time. Through working in that way, then we can make sure that things aren't duplicated, that everybody knows what that support package looks like. So by connecting it in with clusters and advice and guidance, that's a really key mechanism to making sure that that, as Sinead said, that young people are not just being referred everywhere and then everybody's trying to pick it up and nothing feels coordinated either for the family or for services that are trying to support them, that it just pulls that coordination together and enables the support to happen that little bit quicker, in terms of making sure that things are connected, that if they need the family support, that they've got the family support, but that actually the social prescriber can do a lot of that connecting. And quite often the answer is in the community or is in a particular service, but it's making sure the family feel connected to that journey and feel that they understand that service is the right service. So if CAMS are saying that they don't meet CAMS service, but they still feel they need support, that they understand that it isn't a rejection from CAMS, it's the best place for you to be supported is in your community, and the social prescriber will help you get that support that you need. So the parent and the young person feels really part of that decision and really clear on why that decision's being made. So I think that's kind of where we're looking at in the future. Our funding, as this pilot is starting to come to an end up to March, but hopefully, like Armley's carrying on, we're in talk with Beeston around this model and kind of really piloting this model as the next phase and what that children's health MDT looks like. So that's really exciting, and hopefully, like I say, this can help feed into other ways it can be offered, I guess, consistently across the city, because I'm conscious that we've talked about the south and the west where we're operating, but I know, for example, that I met with Hamara's care navigators in the east, and I know that they're doing something really similar, which is great. So it's just about how that becomes consistent, how we can share and learn from each other, and I guess having a think about kind of how do you, if we want to run across the city, how do we make sure that that relational whole family approach can sit in that, and how do we support each other and make sure that that connection and knowledge of what is in the city flexibility is utilised to its best advantage. Because I think one of the things for us, it has been that seamless approach of knowing what's out there, of our workers really kind of understanding what services are to offer and where to link into. And sometimes maybe some of the gaps that we think might be there aren't actually there. It's just knowing that where to go for the support. I mean, I would never have known that a power football club existed, but our worker found it for the young person. I managed to engage them into it. So I think, do you know what I mean, that's a kind of just, I guess, really a really good way of kind of pulling this to a close. I don't know if hopefully that's been helpful and not too information heavy, but happy to answer any questions. And like Sinead said, if anybody wants to speak some more about it or in more detail away from today, more than happy for my email to be shared to have different conversations with people, if that would be helpful.
Thanks.